Thank you very much. Thank you, USI, President Dr. Sanjay Kulkarni, Dr. Dinesh Agrawal, and everybody and friends. This is a point of technique we've actually sort of published very long back, and I actually have forgotten about it. One of our fellows was actually doing a review article, a historical article for one of the journals, and he was using the use of staplers in urology. And he said, do you know you were the first one who actually sort of used it for a cystectomy itself? And I was not very sure. And this is how sort of it all started. We way back published in 1998. What happened was, when I went to UK that time, many bladder cancers, the primary treatment was radiotherapy. Radiotherapy was not so well advanced as of today. And many patients used to come to NHS hospitals where you were forced to do a cystectomy as a salvage cystectomy, either for hematuria, bleeding, recurrent disease, what to do? And to do a cystectomy, I think people were not very keen because the place is very frozen. You go there, you have bleeding, you have infections, you have post-op complications, you can't use clips, sutures would cut through, and this was a problem which was going on. I was working in the theater, and one of the laparoscopic surgeons called as Bob Holly, he was working in another theater, and I'm talking about 96, 97, that particular time. And he got Endo GIA stapler, put it through the laparoscope, and was using it. And I said, why don't we use it for a cystectomy? This is how all the idea started. So what we did was, at that time, you mobilize the bladder preliminarily at the level of urachus. It's all completely frozen. So use sort of Endo GIA stapler because there is nothing you can separate as a pedicle from the lateral pelvic wall. So either you can use one or two, depending on sort of how fibrous it is. And this is how we first published in 1998. And John Fitzpatrick was absolutely on the moon when he received this, and he just published it as a point of technique. Now, this was a morbid operation, as you know. And as time has gone by, I think there has been a lot of improvisation on the cystectomy. It was well received thereafter, and this is how it looked like, and we started using it even for a dorsal complex. Before that, there was one case report where this stapler was used for a radical prostatectomy. That was only one report before actually sort of we did it for radical cystectomy. And then subsequently, I think since the laparoscopy has come up, I think people have found it much more easier. Even all my friends are now saying that we never knew you were the first one who actually published it about. And this was born out of the necessity because of the frozen pelvis because of radiotherapy. In today's context also now, where we are moving towards trimodality therapy, 1 in 3 patients would require a salvage cystectomy. So I think this is how also can be useful. So I'm happy to show that the technique which was innovated almost 25 years ago finds a relevance even as today, something is unique about it. This would not have happened. My consultant, Nick Waterfall, and he was a urologist at Bedford Hospital. And whichever new ideas I would have, he was there just to support. And he said, come on, Mac, you can just go ahead and do it. And I'm really grateful to him. He's almost now age 80, a wonderful human being. And these were the 2 hospitals where we actually popularized. In fact, I got my job in Edinburgh Hospital when this was just published in BJUI. So it has a double pleasure for me. Thank you very much.
Thank you, Makran. Your technique is now being used for